This week's episode is brought to you by Adam and Eve, your go-to for intimacy toys you'll never get tired of. I browsed their site and immediately started shopping. They offer 24/7 support, 90-day returns, and always discreet packaging. To celebrate 50 years in business, Adam and Eve is offering my listeners 50% off one item, plus free shipping in the US and Canada, and free rush processing. Some restrictions apply. Visit adamandeve.com and use code PLEASEME for this amazing deal. What will you get? Welcome to Please Me, the podcast bringing you bold conversations and big clit energy. And welcome to my Friday bonus episode series. I'm Eve, your host, on a journey from trauma to sexual liberation. Let's reclaim pleasure and close the orgasm gap, one empowering conversation at a time. Today, you will learn about painful sex, its causes, and how you can fix it. If you experience this, you will know that it is a very big deal, and learning how to eliminate that pain so that we can enjoy all the delicious sensations and sensual pleasure that we were built for is key and is what this episode is all about. Did you know that podcasts rely on listener support to keep bringing you the content you love? For the best way to support the show, join me on Patreon for ad-free listening, early releases, bonus episodes, and exclusive content. See show notes for the link. Thanks to all my listeners overseas in Bangladesh, Germany, United Arab Emirates, and Iceland. Please share this episode with a friend and help me spread essential sexual education around the world. In the US, hello to my pleasure seekers in Atlanta, Seattle, Boston, New York, San Jose, and Albuquerque. Be sure to share and spread the love. Please Me is for mature audiences. Sit back, relax, and surrender to the pleasure of Please Me. Hello, and welcome to Please Me, the Friday edition. And I'm so excited to be talking to you today about painful sex. Painful sex is something that a lot of people experience. It's common for women more than men. And there's multiple reasons why people can experience painful sex. And we're going to talk about some of those reasons today. What is painful sex? So there is a medical term called dyspareunia. And that is the medical term for painful sex. And it refers to recurrent or persistent pain during sexual intercourse. And approximately 10 to 20% of US women experience dyspareunia, which is painful sex during penetration. It has a lot of impacts on our emotional, relational, and mental health. And so it's really important to talk about this because a lot of people experience it and they just don't seek help because they feel like it's a shameful thing to talk about. And it's super, super common. And it's something that you can get help for. Some of the reasons why a woman might have painful sex or painful penetration would be vaginal dryness or hormonal imbalances. So we're going to talk about those things. There's also psychological causes that can also trigger dyspareunia or painful sex. Anxiety, stress, previous trauma can also make the body tense, and that could lead to discomfort or pain during sex. And like I mentioned before, 10 out of 20% of women experience this, but it's thought that 3 out of 4 women will experience painful sex at some point in their lives. So this is actually quite a prevalent experience that almost all women at some time of their lives will experience. So I want to talk a little bit about the difference between dyspareunia and vaginismus. So dyspareunia is pain during penetration, and vaginismus is an involuntary contraction or tightening of the pelvic floor or vaginal muscles, making sex painful and penetration specifically painful or even impossible. Some of the causes of vaginismus are psychological, including past trauma, anxiety, fear of pain. So if you already know that you have pain when you have penetration, the thought of it can also trigger it, right? And then cultural factors can play into having this type of pain. So, some of the causes of vaginismus are actually psychological in nature. Like I mentioned before, you can have a physical issue, meaning the muscles will tense, but it's coming because of what you're thinking about, right? And some of the symptoms are defined as involuntary muscle spasms or contractions in the vaginal muscles during attempted penetration, making it extremely painful or impossible to have intercourse. So, if you think about something that you are going to experience pain, you might tense up, right? And those muscles in your pelvic floor and in your vagina can also spasm. And so, if you're having recurring spasms, even when you're not in that sexual realm, so it's not like you're having sex, but you are having these spasms, this can be something that can be treated with pelvic floor therapy. And so a lot of times people think, oh, pelvic floor therapy, that's for strengthening. If you're having spasms, that does not necessarily mean that you have weak muscles in that area. It just means that they're spasming. And any spasming muscle, if you've ever had a Charlie horse in your calf or something like that, is extremely painful. So, the first step to treating vaginismus is to bring down the spasming of the muscles. And so pelvic floor therapists are professionals at doing this type of thing. Just like getting like a massage when you massage your muscles and they're really tensed up and you have lots of knots, etc. You can create those same type of knots in the pelvic floor and the vagina as well. So pelvic floor therapists can find those knots and can relax those muscles so that you can stop having these spasms. So that's number one in the treatment of vaginismus. Dyspareunia is pain during intercourse, often caused by physical factors like dryness, infection, or hormonal imbalances. So it's typically experienced as ongoing pain during intercourse or after intercourse. So a lot of times you may not have pain during intercourse, but you may have pain after intercourse. So that's another thing that can happen with painful sex and dyspareunia. But on the other hand, if you're talking about vaginismus, it's actually involuntary muscle contractions that cause a physical barrier. So the muscles get so tight that the penis cannot enter into the canal because there's actual a physical barrier blocking. The muscles are actually blocking any kind of penetration, and that can be extremely painful, especially when somebody doesn't understand that you're experiencing this and they try to have penetration anyway. It can be extremely painful. So I want to talk about prepping for pain-free sex, okay? And one of the things that you can do to try to decrease pain during sex is to really get into your body and to really focus on the sensations that you're feeling and to remember that the entire body is an erogenous zone. And so it takes women 20 to 25 minutes to get ready for penetration, right? For a man, they can think about sex and they instantly have a hard on, right? And they have an erection and they're ready to go. But for a woman, it takes us 20 to 25 minutes to actually be prepared for penetration. And that involves getting the blood flow to the clitoris. The clitoris is the man's equivalent, the female equivalent, I should say, of the man's penis. And our clitoris has to become engorged in order to be ready for penetration. And a lot of people don't realize that and they skip very essential first steps. So think about foreplay as the preparation for penetration. And there's so many things that you can do. Oral sex is one of those things that is really helpful to get a woman prepared for penetration. And of course there's touching of the genital area, but if you think about the entire body as being an erogenous zone, exploring the entire body and allowing those sensations from your exploration to really heighten your experience and your sexual energy. Because if your sexual energy is heightened, then you're going to be more ready for penetration. And it does take time. For women, it really does take time. So you have to slow down and really pay attention to your body and really pay attention to the moment that you're in and really get into your body. There's also comfortable positions that you can play with for painless sex. And really, that's going to depend on the person and their body. So, for instance, if someone has a retrograde uterus, the positions that they like are going to be different than someone who doesn't have that condition in their uterus. So, really, it's very individual. And I want you to think about the switching positions as an exploration of all of the wonderful things that you can do in the bedroom. But also, if a position is causing pain, try a different position that might be more comfortable. And I find that one of the most comfortable positions is laying on your side and having the partner behind you, because that is an easy way for him to explore with his hands on your body. It also gives you the ability to move at your own rate. And so it's a nice position and a comfortable position. So explore different positions and see which ones work for you. Sex is not just intercourse, of course. It is all of the sexual experience, from foreplay all the way to aftercare. So try to think about it as an ongoing experience and really try to slow down and enjoy all the different parts of the experience, whether it be sensory play, maybe a little impact play can sometimes be a turn on, which is something like spanking, and then the sexual intercourse, and then the afterplay and the aftercare is so important too. Checking in with your partner, bringing your partner water, having them bring you water, bringing a nice hot towel, using the bathroom. Using the bathroom is so important right after sex so that you don't get a urinary tract infection. So going and relieving yourself and urinating is really important to avoid urinary tract infections and other vaginal infections. Let's talk about hormones. So hormones are so important for sex as well. And in the past, I've talked a lot about estrogen and how estrogen is part of the skin complex of your vagina, the part of your bladder, your vulva. And when you don't have enough estrogen, the skin is actually has spaces in it where those estrogen receptors are. And if there's not enough estrogen, those spaces are going to be empty. And so it's going to actually cause your skin to become very thin and papery. And that thin and papery skin can have like little tiny micro tears that you don't even see, but you can certainly feel them. A lot of women in menopause will say that sometimes having sex feels like there's razor blades down there, like constantly cutting them. And that is an extremely painful situation. So estrogen plays a very critical role in our sexual function. So if you're not sure if you have issues with estrogen, when you go to your doctor, ask for blood work. And blood work is going to show if you have low estrogen, low progesterone, low DHEA, low testosterone. All of these sex hormones are important to be at the right balance in order for your body to have a pleasurable sex. So checking your hormones is key. And for women, of course, during menopause, our hormones decrease, which causes sometimes decreased vaginal sensitivity and dryness. And so this is something that can be actually treated. And you can add lube for lubrication. There's lots of lubes out there. Experiment and find the ones that you love the most. I love Bonnie's Herbals. I talk about them on my show. I've used them myself. And I also just love plain old coconut oil. Coconut oil is a great lubricant. It also has natural antimicrobial properties. It smells nice. It tastes nice. So that is also something that a lot of people have in their kitchen. And hormonal imbalances can contribute to conditions like vaginismus, where involuntary muscle contractions cause pain. So we already talked about that. That's something that is treatable through a pelvic floor therapist. So there's also something that you can do to treat painful sex called a spacer. And a spacer basically is like a very small dildo. And then you can work on using bigger and bigger ones until you get to the point where you're not having pain during penetration. And so that is another treatment that can be done in a physical therapy practice as well. So there are many different options that you can explore if you're experiencing painful sex. And I want everybody to know about them because Sometimes people internalize this as that there's something wrong with them, and there's absolutely nothing wrong with you if you're experiencing painful sex. Many people experience it. You may never experience it until you get to your 50s, or maybe you experience it early on and then it goes away. But many women experience painful sex, and it's super important to know that there is help out there and there are solutions. So I just want to summarize a few of the key points: the difference between vaginismus and dyspareunia. Vaginismus is the spasming. Dyspareunia is just the general umbrella term for painful sex. Knowing that there are options for help, you can use lubricant. You have to prep your body 20 to 25 minutes of touching your body and getting your body engorged, your clitoris engorged, is going to help you to decrease that pain. You can also seek help from a physical therapist like myself. I treat conditions of the pelvic floor, and this is one of the conditions that I treat. And also looking at your hormones. So those are all things that you can do. So if you are interested in getting any more information about painful sex, you can reach out to me on pleaseme.online and say hello. There's a contact page. Go ahead and send me an email, and I'm happy to answer your questions. And if you want to set up a coaching session, I am certainly open for that as well. I do intimacy coaching, and I also offer physical therapy practices in my clinic called Inspire Health Physical Therapy and Wellness. So if you are experiencing any of these types of symptoms, know that you're not alone. There is no shame in having any sexual health conditions, and there is help available. Until next time, I have a personal question to ask you. Are you experiencing vaginal dryness? Are you looking for an all-natural lube that helps you get the juices flowing? I will give you a tip on what I use. I use Bonnie's Herbals. I use the sex butter for those intimate moments, and I use the boudoir butter for my everyday moisture. And these have been game changers for me. So check out the link in the show notes and get yours today.